Well, welcome everyone. I'm Donald Weeks, founder of CEO and ClearPath AI, and your host for the Clinic Efficiency Podcast. I'm really excited for today's conversation. Today, I'm joined by Laura Lamont, founder of Enable, and Laura built Enable Shampoo to address two very real and growing issues in healthcare: hair loss associated with GLP-1 medications like Ozempic, and product accessibility for individuals with limited grip strength. What stood out to me is that it isn't just a cosmetic product. It's built around real health signals and patient experience. Laura, welcome.
Hi, how are you doing? Good
Hi.
to see you.
Great. Laura, if you would tell us a little bit about yourself and how Enable came about.
I'm an ex-corporate America employee, got a liberal arts degree out of school, and self-financed my education. So I've always worked really hard. So what happened was after my corporate experience, I was kind of called and sort of came up with this idea of a weighted blanket to calm my own sensory needs. And I've had that company. I still have that company. I've been in it for about 10 years. But what I realized was, as I got over 50 and well into 50, that I had trouble gripping things and that, I used a lot of hair products on my hair because my hair is really curly. So I couldn't press down the mousse or open the shampoo bottle. So
Right.
I realized that, did research through National Institutes on Health and realized that, grip strength is dissipated with age for a number of reasons. And it's connected to really any health condition that you have. Like, if as you age, you have, high blood pressure or diabetes or cancer or heart issues, all those lead to a decrease in grip strength. So it was important for me to be able to find a new product that I thought I could bring to the market that would help people, because the weighted blankets have always helped people. So the
Right.
company that I own is Mosaic Weighted Blankets. But I felt like, Enable would be a new iteration. So I worked with a company called Tricor Braun. We came up with a cap that is very easy to open. Actually, you can just touch it. It's just like you can open it with your chin. You can open it elbow. It's for the 18% of the American population that has a disability. And it's for the other 20% of the US population that is over 50. So there's people that are growing into this with these grip strength issues. So the shampoo bottle's easy to hold in your hand. It has a plastic grippable bottle, special plastic. It's gender neutral for men and women. So you don't have to necessarily think, oh, this is beauty, right? The other thing that came to me as I was developing this product was that I'm one of the people that's had great benefit through the GLP-1 and the trizipatide products, right? Which are, what they do is they change your hormones a little bit to make you not hungry. So in my experience, I went about 3 to 6 months and then, my hair, which has always been indestructible, began to fall out and I began to see shedding and some of the things that people see. So when we formulated Enable, it was important to me to go at it with a high quality shampoo. It has Swertia japonica in it. It has sea buckthorn oil and it has fennel. So it has a lot of protective products. And so I felt like, general medical awareness, if you're on a product that you're on a prescription for, you just need to be aware that it can affect your skin and your hair and your nails. So when we formulated Enable, I feel like if somebody's going to go on a GLP-1, if you get in there early and use a high quality shampoo, when, you can't go with just like the $7.99 product from, your grocery store, because it has sulfa in it, it has the sulfonites and things that are going to, strip your hair of grease, right?
Right.
And the other thing is it's kind of age agnostic. I mean, there are, people, you don't have to be 45 or 50 and be on these products and see that, your hair is going to start, thinning. But you go 3 to 6 months, you lose 18 or 20 pounds, and all of a sudden, your hair starts to break, start to have hair problems, but you don't want to quit because you're on a weight loss journey. And a lot of people have really dramatic success with this product. So the Swertia japonica is a unique part of the shampoo and the conditioner. And, it's been proven to, along with the collagen peptides, to protect your hair and to accelerate hair growth. And we do have some people that have used it that have seen really, really good results. I will say if people wanna know what collagen peptides are, collagen peptides sort of run to the roots of your hair and scrub off all the oil and scrub off everything that's blocking the hair from growing, right? So
Right,
it kinda runs in there and it sort of scrubs out all those little places at your follicles, and it leads to extra hair growth. So this also has a healthy dose of collagen in it. But anyway,
right,
I just saw a need for people that need accommodation, and that need to have a better plan before they go on a major drug. I mean, 14% of the United States has tried, the GLP-1s and the trizepatides, and that market's only gonna grow. So we felt like we're in a good position in addressing a need, both with accessibility and with the other, the hair growth market as well.
right. Well, Enable sits at the intersection of chronic care trends and functional product design. Laura, when did the idea really crystallize for you that GLP-1 related hair loss and grip strength accessibility were unmet needs worth building around?
I was one of the first adopters of a GLP-1, and then I moved to trizepatide. So I would say I've been on this drug for 2 years and saw the great benefits of the weight loss. I'm a petite, small person. I'm under 5 feet tall, and I lost about 35 or 40 pounds.
Right.
And at first, my hair was not affected the first 6 months, and then all of a sudden it started creeping up on me. The GLP-1 is the number 1 search, like, under beauty products.
Okay.
It's on a tear, right? So, as I was developing and doing this research with, like, National Institutes of Health and realized the grip strength, at that point, I realized that a lot of our product customers would be over 45 years old. And, you do tend to lose your hair when you get older. So I thought
Right.
that we would go ahead and just put a high quality shampoo in there that as that coincided with my GLP-1 hair loss, that was a good decision because it made me, realize that we also had this added benefit in our shampoo.
Sure. Yeah, that's great. Well, the GLP-1 medications are exploding in popularity, but side effects often lag behind adoption. How are you thinking about the scale of this hair loss issue? Is this a niche concern or something clinic owners should actively be aware of?
Well, I mean, if you're in the medical field, it doesn't matter what medical field you're in, you're gonna touch on somebody that's in the GLP-1 because so many people are doing it. And weight loss, like, my twin sister has essentially eliminated having a fatty liver with the GLP-1 medications.
Right.
Um,
Wow.
so yeah, like they're seeing, medical miracles from it. They're also seeing other things that aren't so great, like if you've had pancreatitis or thyroid cancer, I just think any medical professional should be aware of, and many are, of the effects of the GLP-1 because it is just trumped in like, I don't want to say Trojan horse, but it is trumped in like a horse to the medical landscape, and it's gonna iterate into other products. Now they have it in a pill. And so I just think that, people should be aware of, and also I think that, you know, I don't wanna say vanity or whatever, but patients' overall self-confidence is greatly affected by their hair. So, I call it just hair trauma, right? That's my saying.
Right.
Most men have been through hair trauma. They get to be 27 or 28 and they realize, I'm not going to have a lot of hair. So a lot of men have resigned themselves to that. And that's a huge market for men. But with women, it's a real shocker and it doesn't really matter. I mean, from what I can tell, I've been on tons of Facebook boards. I've, talked to people that are purchasing the shampoo. It seems to be agnostic to your age. And I have no medical
Right.
research on that. But I just think that, as illnesses crop up with people and the older we get, you just look at the proliferation of any kind of medical condition. It's not always what medical condition do you have or what medical condition has you, right? I mean,
Right. That's right.
I have a friend that has had MS and we're really, really great friends. And she's 10 years older than me and she has dealt with mild MS. And then my twin sister and I have a best friend who got MS and she was gone in 2 years, right? So just see all kinds of illnesses with people and that runs across your path in the medical profession. So I would just make sure that you made a special note to do a deep dive on GLP-1, trizepatide, what the difference between those are, and then, I mean, possibly, have a recommendation of something for them to use, as well as patients that have arthritis that can't grip anything, that are likely to fall in the shower. I mean, our shampoo's lightweight. Once it's open from the top, you can set it upside down in the shower. It's easy to grip. If you drop it in the shower, it's not the end of the world. It's only, 9.2 fluid ounces. And so I think people that are aging or people that are concerned, with mobility issues, I mean, I think they need to not purchase the super, discount shampoo that's, 14, $8 at the end of the aisle because of the chance that they have of dropping it, right?
Right.
Um,
That's right.
as well as, general mobility issues. Like if you're older and an older person, make sure that they have a clear path to the shampoo, to the shower. Make sure that, if you have to do that bathroom upgrade, make sure they're
Right.
using the bathroom in their house as the easiest to use, put grips in the bathtub or grips in the shower. You can get grips for the mat towel when you get out of the shower, so you're not greatly about to fall. There's just a lot of concerns that go into being a senior, and sometimes it's really hard to get through your day. I'm not totally a senior, but I'm kind of there. So I decided that I was going to make my big story that I have a little blog about is I decided I was going to make tuna fish. And my fellow was golfing, and my kid, he's moved out now, but he was about 21 at the time he was gone. So I got out the tuna fish can, opened the tuna fish can, no problem, drained the tuna, got the eggs done, got everything ready to go, but I had to open a jar of sweet pickles. So I wrestled with those sweet pickles. I mean, I ran them under hot water. I banged them on the ground, whatever I could do. I did not have the physical strength to open the pickles. I did not want to go to the neighbor. I did not want to go through the humiliation of telling somebody I can't open a jar of pickles. So actually, I just went out to eat.
Right. Okay.
So that's
Right.
the kind of stuff I'm talking about. But anyway, I didn't mean to hijack
Right.
your question, but
No, that's okay. Well, you've explained that GLP-1 drugs alter hormones in a way that dries the hair follicle. How did you approach formulating Enable to address that mechanism specifically?
what I did was, I worked with a supplier and they had an award-winning shampoo that had great product in it. And so I did a custom formulation. Most people that do a shampoo, they're going to look at different things. I think
Right.
the main thing that was important for us was the collagen. And then also we found out that we had access to the sea buckthorn oil and the fennel. If you have curly hair, by the way, the fennel really will make your curls pop and stand out. So to some people, that's a big deal. I mean, to somebody like me, right, to find that curl. And a
Sure.
large percentage of our population has curls. But anyway, I just tried to go ahead and make a really, really good quality product out of the gate before I got into it. So I had a custom formulation done, and it's popular, and it's done well, and we see good results with our customers.
Yeah. Oh, that's good. One thing that really stood out in our conversation was your emphasis on grip strength as an indicator of overall health. Why is grip strength such an important marker, and why should physical therapists and clinic owners care about packaging and design?
Well, everyone that I have spoken with that is an OT or a PT, so many of those people that I've talked to in the industry, they're like, oh, yeah, you get it about grip strength. So many people don't get it, right? So they're already
Right.
aware of it. It's just maybe another thing that they can add in their toolbox when they're, diagnosing the overall health of a patient. I mean, I'm not a doctor. I'm just saying that I thought that was really interesting. The National Institutes of Health had a study on that, and that most of the documentation that you see online is parroted from that study.
Right.
So I just think that it might be a great indicator of overall health. I mean, if, I think you talked about you had a family member that they had a big health problem and they didn't know until they went in. If all of
Right.
a sudden you're losing your grip strength for some unbeknownst reason, it might not be a bad idea to track it down with the health professional.
Right. Absolutely. Yeah, most consumer health products aren't designed with aging, arthritis, or limited dexterity in mind. But how intentional were you about designing Enable's packaging for low grip strength users? I know you've talked about it already, but
I mean, that for me,
yeah,
that was the key because I couldn't open stuff, right?
right,
I mean, I'm
right.
using scissors on Amazon packages, I can't. And the thing is, the honey-do list. "Oh, honey, can you open this? Oh, honey, can you open that? Oh, honey, can you open this gate in the backyard? Oh, honey, can you open these chips?" It when you get that kind of redundant behavior, I just realized there was nothing on the market to accommodate people that had grip strength issues in regard to a shampoo and conditioner product.
Laura, you currently have, I think you said, around 20,000 bottles in inventory and are looking to scale distribution, especially through Amazon or social media. How are you thinking about go to market right now?
I mean, we're already in market and we have, testimonials and customers that are real happy with the product. The marketing costs associated with a product launch are big, and I'm a little person and my weighted blanket company is small. So I am potentially looking for anybody that's an investor that would want to, co-invest to come in with the marketing. We've got the product ready to go. We are in market. We're getting good reviews and things are going fine. But sometimes to get to that next scale, it would be nice to have an investor. If somebody was interested in talking with me, I'd be totally open to talking with them.
Right,
And it's a
absolutely.
and we're talking 20% of the US population. So 3 things, 18% of the population has a disability seen or unseen. A lot of disabilities affect your grip strength, right? The second thing is, 14% of the market has tried the GLP-1s and they're moving forward with that. So that's a thing, that's gonna be a growth market. And then the third thing is that 20% of Americans are over 60 years old, or I'm sorry, over 50 years old. So, we're really faced with an aging population and accommodating them. So, those are kind of my 3 points of light as far as the market.
Okay. Yeah. If Enable works exactly as you envision over the next 3 to 5 years, what does it become? A niche GLP-1 product or a broader accessible personal care brand or something else?
I mean, for me, my main love is, falling in love with this idea of the grip strength issues and how to address that. So I could see it in your grocery store. I mean, I could see other products that go with other personal care systems that have no workaround right now for somebody that has a healthcare issue. Um, enabling your hair to grow is also a concept, right? So I guess we'll have
Right.
to see where the GLP, trend leads and how that medication changes or if it stays the same. But I'd love for people to walk into, their local pharmacy or their local grocery store and have their grandmother and say, "Oh yeah, I've got to pick up some Enable products for her." So that's really my hope and my plan for Enable accessible products.
That's great. Well, Laura, thank you so much for sharing your insights. This was incredibly valuable. I really appreciate your time and openness. And hopefully, we'll go out and get some ourselves. My wife has that grip strength problem as well. So I think that would be good.
And everybody can use more hair, right?
That's right. Thank you so much.